Hi, everyone. This is another Healthy Root series. We're at the session 9, and today we're going to talk about movement and how's that going to be as a medicine and helpful for all what we do before, during, and after any of the treatments, whether it's PRP treatment, prolotherapy, or infusion therapy. And we have our guest honor here, Dr. Crystal, and myself will walk you through the next 15, 20 minutes or so to talk about all about this. So, Crystal, I'd like you to lead the way.
All right. So we always start all of our sessions with a quote. And so this quote here says, movement is a medicine for creating change in a person's physical, emotional, and mental states. And so obviously, if you're coming here to the clinic, you've got some form of arthritis that's preventing you from doing the things that you want to be doing on a daily basis. And you know how that can affect you physically, emotionally, and mentally as well. And so we want to have a discussion around movement and ensuring that while you're going through the therapies here at Arthritis VIP, that we are encouraging movement because that's sort of like the homework that you do to ensure that the joint gets the nutrition that it needs to function as best as it can. So there are four major ways how movement can really help arthritis in general. So the first one is that it can help improve the range of motion. And this is really important because it helps with mobility and flexibility. And it can, when you increase somebody's range of motion, you can also decrease the discomfort. So, if you were struggling to comb your hair, then we know that we have to improve your range of motion when it comes to your shoulders. If you have any difficulties walking, then there can be improving of the range of motion at the knees or the ankle area. And obviously, the things that we're going to talk about today and in previous weeks that we've talked about, they're just a general sort of like screener to, plant the seed, get you educated on these aspects. But for some people and for some cases, seeing a physiotherapist or a chiro to help in this case with increasing the range of motion can be really helpful in cases like this.
Just to add a couple of things before we move on, I'd like this point is uh, if you guys remember, this is going to come up when we talk about physical stressors. Most people think of the physical stressors is because we overuse things. And that's kind of, yes, is true. But the truth is, for 95% of the general population, it's because of lack of use, not because of
Absolutely.
overuse. So we think of hey, maybe you're going to get some knee pain, hip pain because you've been running marathons. But reality is, most of us, because we're sitting too much on our chairs, we're not mobilizing more enough. And most people should have between 7 to 10,000 steps per day, and average North American is in the range of 1,500 to 2,000 steps. And that's called an average. So those people are walking 20,000, pulled up that average, believe it or not. And statistically, from you think about it in the US, there is 50 million people in the United States that use their car for a distance less than a kilometer. That's per day. And
Right.
people looked at that from a traffic point of view, not from mobility, but I look at it from a different point. It's less than a kilometer away, which literally takes you 15 minutes if you're on the slow end. It might take you 10 minutes if you're brisk walking. And most 50 million Americans use their car to commute 1 kilometer per day, right? And that's what we talk about if lack of mobility. You need that mobility not just because of the range of motion. Those are the other aspects we're going to talk about today. Is this is how you remove toxin. This is how you hydrate the joint. This is how you're gonna get more nutrition to the joint, and of course, gonna reduce the discomfort and increase functionality.
Yeah, it's funny because when you were talking about the 10 that like the averages for steps per day, I remember when I first got a Fitbit, this is like, oh my goodness, maybe 10 years ago. And I was getting my patient who has type 2 diabetes for 10 years on insulin, on all the medication, has neuropathy, so pain in the feet. He was averaging, I think 3,500 steps a day. And so then when I just got my Fitbit, I was like, you know what? Let me see how much I'm averaging. I was averaging 1,500 steps a day.
Yeah.
So half of what my type 2 diabetic patient was averaging. And that was humbling. And I wouldn't have known that if I didn't wear my Fitbit. And you can easily get little pedometers that you can, they're like $5 at the sports stores or less than that, just to track how many steps you're doing. But unless you start tracking, you don't know. And then unless you start to be accountable and paying attention to those metrics, you just don't know. And you assume you're in good health when in reality, you're a couch potato.
100%. So that same analogy or same example that you mentioned, same thing with the Fitbit about 6-7 years ago. I thought I was active, so I calculated stuff without intention to walk, and I came shy of 2,000 steps per day. And
Yeah.
now I make an effort when I go from room to room. I got to do a full loop. I park my car far. I walk. I intentionally walk to get my 7 to 10,000 steps per day. And unless you, so first step with anything that we do in life is you need to know where you are, and
Yes.
then you got to figure out what your goal is. You might not be able, because of arthritis or chronic pain, able to do the 10,000 or 7,000, and that's okay. So to me, one of the things I would say to a lot of patients is, I want you to increase 100 step every week. And he said, that's it? I said, yeah, that's it. By the end of the year, you're up to 5,000 steps. It's
Yeah.
only 100 steps per week, right? Don't push yourself, and your body's you get used to it. By the end of the year, you're gonna able to do on your an extra 5,000 based on your baseline, which could be 1,000, 2,000. Now you're there to 6, 7,000. So
Absolutely.
it's an easy, continuous, small progress. Don't push yourself too hard. And funny to say, I had one patient today. She is generally healthy, a little bit on the oversize. She's in her 55 to 60 years old. She decided 2 years ago to become healthy, to lose some weight. She went for 2 sessions of brisk running.
Oh, wow. Okay.
Only 2 sessions.
Yeah.
She messed up her lateral collateral ligament, medial collateral ligament. Now she started having arthritis in her knee because she did not take it easy. And now what she did the last 2 years, she avoided not just running, walking completely, thinking that if I walk, I'm going to hurt myself. So that went from basically the extreme of I overdo it, to not doing it at all. Yeah. And now it's going to be very hard to get her back on her feet, because we need to restore everything: mobility, function, range of motion. So it's going to be harder to treat if you don't take care of yourself early on.
Absolutely. And I see this all the time with my chronic fatigue patients, where we do things to really help alleviate some of that fatigue that they have. And I tell them, like, listen, you're going to feel great, but please do not overdo it, because now you're going to set yourself way back to the before time. So it's really like what you mentioned earlier on. It's keeping it small, sustainable goals, and not going from the extremes, but making those small little bits of progress. And this is where it comes into, movement helps with creating stronger muscles. So we're not asking you to go bench press, so many pounds at the end of this week, but the importance of having those stronger muscles, as you can see in that picture, it helps to support the joints. They help to decrease discomfort, because when you've got strong muscles surrounding those joints, you have less pressure happening to the joint space itself. So, it's about, again, what we were talking about before. It's know where you are, know your baseline, and then let's increase it very gradually. And this is how movement helps with arthritis.
One other thing, when I use the Fitbit personally, is not just about figuring out how many steps I did per day. Now I felt accountable. So that is really a big factor to this. And after a year or so, my Fitbit got drowned. Literally, they said it was water resistant, and now it's not working anymore. But funny to say that all cell phones have them. If you activate the app on them, any smartphone will have that functionality. So you can, most people carry their phone most of the time. So when you do, that will be an accountability. Oh, I'm short 1,000. I got to do this. I got to do that. Right. And you can set multiple goals. I say by noon, I got to do this. By four
Yes.
o'clock, I got to hit. So you don't put a lump and then, oh, it's 7 p.m. Now I got to do 3,000 steps. And
Right.
yeah, so don't do it that way. Maybe break it into 3 or 4 mini targets throughout the day. That way, you're always moving, continuously moving, and it's much more healthier than doing it all one shot.
Oh, absolutely. I mean, like when you think about 1,000 years ago, humans were moving all day long. They weren't, sitting sedentary for 8 hours of the day and then suddenly getting up, right? Like our species would not have persisted if we only moved for, an hour a day. Um, but here, so talking about better endurance. So whenever you are exercising or moving, you are strengthening your heart, your lungs, your overall health. And this actually reduces fatigue. So people will often tell me that, hey, I've noticed that since I've been incorporating more movement into my daily activity, that I actually feel like I have more energy to like cook dinner, or I actually feel like I have more energy to, get through the other half of my day. And this is common. And what you'll start to notice is that once you're consistent with hitting specific targets with movement on a daily basis, you're going to start to plateau, and then you need to challenge yourself by increasing it again by another 5-10%. And looking at that as a way of like celebrating that your body can do what it just did and it can accommodate for more, like that's a great sense of accomplishment. And the constant moving and the daily movement helps to maintain that optimal weight. So we know that if you are overweight or obese, that puts way more pressure on the joints. And so by improving daily movement and exercise throughout the day, we can help people to naturally attain a better weight that supports joint health overall.
So, a couple of other points I'd like to kind of integrate what we've done before. When you're walking, try to get two for one deal. That's when you gotta focus on your breathing techniques. So that way, if you really master the breathing techniques that we talked about, the 4 in, 4 out, that will literally help reduce your fatigue, increase your stamina, and at the same two other byproduct of the walking or the movement or the activity that's really really helpful is a lot of people with chronic pain and arthritis have constipation, and movement is a great way
Yes.
to get rid of constipation.
Oh,
And
absolutely.
it's a great way to improve depression and anxiety because
Yes.
it increases endorphin. You don't have to sweat. Trust me, you don't have to sweat. Just walk with that breathing technique, and you do that for 20 minutes, 30 minutes, once or twice a day, and you're gonna notice that effect on it. So they did one study up in UCLA, Berkeley, where they brought people that would walk for 45 minutes every day versus people that will get antidepressant, and they watched them for 60 days, which is 2 months. And the people that were walking every day were happier on the anxiety and depression scale
Hmm.
compared to the people that went on pills, because the people that went pills, first it took a lag for it to work. Second part, they were treating side effects by then. So imagine you have something in your hand that not just only increases your mood, increases your stamina, help your fatigue, and most of those pills that we take is gonna increase your chances of not just constipation, anxiety, and overweight. So
Yes.
all those antidepressant will cause you weight gain versus hey, you can get the endorphins, become happy, lose weight at the same time. It cuts your craving for eating junky food. There's a lot of benefit for just walking every day.
Absolutely. And I mean, even when you think about another way that you can compound movement, daily movement, to sort of get benefits in other spheres in your life is having a friend or a family member go on that walk with you, because we know with arthritis, it can feel very isolating when you're in that level of chronic pain. And so, whenever you're connecting with community, that can always sort of lift the mood, lift the spirits. And it also keeps you accountable when you have somebody that you are doing that walk who's encouraging you to get out there. So, there's so many ways that you can compound this and make it work for you.
Awesome.
And another way that movement in general can really help with arthritis, and this is the one that I hold dear and near to my heart, is that it helps to improve balance. And this is ultimately where we can prevent future falls and breaks. So we know that as we age and we get into our 60s, 70s, and 80s, if you fall and break a hip, you're likely not going to be coming out of that any better than what you went into it. In fact, your health drastically declines after a hip fracture. So it's really important that we focus on that balance piece to prevent future falls and breaks in general. So I've listed here some options to help with incorporating movement into your lifestyle on a daily basis. And I've sort of the way how I put them, it's basically going from the most gentlest form, which is going to be Qigong Tai Chi, which is a very slow moving, gentle type of exercise, to restorative yoga, which for most of those yoga poses, you're going to be laying flat on the floor, to walking, and that can be either brisk walking, walking at your pace while you're doing the 4 in, 4 out breathing technique. Yin yoga, which again, you're mainly on the floor for yin yoga, except you're holding specific poses for 3 minutes or longer. This type of yoga is actually phenomenal to help lubricate the joints. But I usually recommend patients start off with a few restorative yoga sessions first before they jump into something like yin yoga, because you do want to get your body acclimatized to the poses. And again, when it comes to specifically yoga in general, no matter what type you decide to choose to practice, always, if it feels uncomfortable, look into doing modifications. Yoga is not supposed to be painful. So if you're attending classes, ask the teacher to give you modifications. Or if you're doing this at home, a lot of YouTube videos will actually show you modifications. So practice that, because in this case, the saying "no pain, no gain," this does not apply to this movement as medicine. Cycling is incredibly helpful, either indoors or outdoors. And I love swimming or any type of aquafit classes. Essentially, when you're in water, it takes off all the pressure from your joints, and you can really work on that range of motion to increase flexibility. Swimming specifically, really great to improve your lung function, your cardiovascular capacities. And so by default, this helps your overall health. And aquafit classes, again, are lovely to really help with that weight loss picture, in addition to increasing range of motion in the joints.
Awesome. Couple of other points I can tell you from my personal experience. I love restorative yoga. I've done that, where basically you get to hold a position for 5 to 10 minutes. That way, the key thing with this, that you need to combine it with your breathing, because the resistance, you'll be resistant to let your joints or body fall. The natural thing, because we're tense, and the idea is every time you breathe out, you let go a couple of degrees down till the body trusts you with that range of motion. So it's not about forcing it, basically let the gravity do its part. What I've noticed, and that was helpful to me before that, if I take a hot shower, or if I'm wearing extra clothes, or even using restorative yoga and hot yoga at the same time. Just note and note, I could not tolerate more than 10 minutes at the beginning with hot yoga, and that's okay. So that's why you can do those stuff at home. Just warm up the room. Now summer is coming. It's going to be warm anyway. So you might open the window. It's going to be hot. Just go and do those couple of YouTube videos and start to do those restorative yoga. It's nice to go walking. We talked about Cycling I like because there is no impact on the joints or the back. So basically, you're doing non-impactful movement or range of motion to the joints. And as you adjust the heights up and down, you get better or different range of motion, whether it's knee and hip. So
Yeah.
that's awesome. You don't want to be hunched. Swimming is amazing. If you have the ability to do it through a salt pool, swimming pool, it will be a little bit better than just a regular chlorine, because chlorine is one of the toxins that we try to avoid, and your body will absorb it. And especially if you have chronic conditions or arthritis or chronic pain, it might flare up for a couple of hours or a couple of days. That's what I've noticed from some patients, where the salt itself is more therapeutic. So that's another way to do that. Yeah, just those are a couple of points that I've had from my personal experience myself.
Yeah. And so the gold, I mean, the ultimate gold standard is to get everyone to be doing that. They're at either one of these exercises options 30 minutes 5 times a week. But again, that means nothing unless you know what your baseline is. So if you, for example, are walking, you're not walking at all throughout the day, then your goal is 5 times a week. You're going to try and walk for 5 minutes once a day. And gradually you'll start to increase that. So again, it's starting from where you are, which then leads us to your next step. So over the next 3 days or so, take a note of how much movement you're getting on a daily basis. Are you walking? Are you exercising? Are you doing brisk walking? And just take a general note and see what that's like for you. And then the goal is that on the fourth day, you're going to be adding 5 minutes to what you're already achieving. Or in the case of, if you want to try to monitor this with your steps, if you're naturally doing 3,000 steps a day, then for the next week or so, you're going to increase that by 100 steps, and you're going to keep doing that as time goes on.
One thing I'd like to add, your ability / endurance, mental capacity is not going to be the same every week. So
Correct.
if you're at 3,500 and you kind of progress over a couple of months to reach that goal, and there's for a week or two you felt tired and you went down to 2,500, it's no big deal. Don't sweat about it. Even bodybuilders can't lift the same weight every single time. Even if you're in the best shape, you can't do the same thing and keep going and increasing upon it all the time. So what sometimes I do, and I found it really helpful, you do that escalating, adding a little bit more more steps or more minutes to your exercise. And after about a month and a half or two, you take a break, you go back to your new baseline. So if you started at 3,000, you went after 2 months to 4,000, you dropped it 3,500 for 2 or 3 weeks, just to give your body enough time to recoup. And you feel that you're achieved, and kind of the new baseline will be the 3,500. So you solidify that before going higher. Because most people
Absolutely.
will go 3,000, 4, 5, 6, and they get exhausted, and the flu hits them, they're down to 2,000, they feel they lost all their gains. But what I want you to do is this is up and down. There's nothing that goes up forever or goes down forever. It's more of a wave like. And
Yes.
you need to incorporate that in part of your routine. One other thing that we didn't talk about, how walking and physical activity is going to improve your quality of sleep. It's essential for quality of sleep, because now you might feel energized daytime, but you're going to feel tired at nighttime. But don't mess it up with naps.
Yes,
Yeah.
absolutely. And I think what you were talking about earlier on, it's, you know, understanding that everything comes in waves, and it's learning to be compassionate with yourself. So when we were talking about the mindfulness piece a few weeks ago, it's, that's where meditation and mindfulness comes into play. It's understanding that, like, your body isn't a machine, it's, and you're in an environment that sometimes you can't control. And there are lots of things that you can and cannot control. And it's learning to work with your body and listen to your body and work within those means and try to challenge it. So on the next slide here, you might want to take a screenshot of it. I've basically left you some resources that you can go on YouTube. So if you're interested in any Qigong Tai Chi, there's a link there, restorative yoga, yin yoga. Just as a little pro tip, when you're looking on YouTube for any yoga flows or any exercises, I do recommend looking for yoga with Adriene. She is a really great yoga instructor, and she basically will give you every modification for every pose that will work within your own range of motion. So I really trust the work that she puts out there.
Is that under the restorative yoga?
So I think I had put it under yin yoga.
Okay.
But one of those links will have a yoga by Adriene. And essentially, anytime you go on YouTube, if you type in yoga by Adriene, she has like dozens upon dozens of different videos to walk you through different yoga exercises and flows.
Just for the audience who's listening, and how do you spell that, Adriene?
I will double check. Yoga by, yeah, so Adriene.
Okay, so it's Adriene for everybody
Correct.
who's listening. Yeah, so search that up. The name again, Adriene.
Correct. Yeah. So just go on YouTube, type that in, and you'll have like a whole host of different things. You will not be bored. I can promise you on that one.
Just from a behavioral point of view, whatever you pick, stick to it for a couple of weeks. Don't jump around, because there's a progression to every joint that you do. And if you keep jumping all over, you might not get a benefit that you're looking for. And actually you might hurt yourself, because you're doing a little bit of this, a little bit of that. And by a month or two, you say, hey, it's not working because I'm not improving, right? It's just because you've been dabbling way too much.
Right. So ultimately, we want people to start to look at exercise or movement as a celebration of what your body can do. So oftentimes, when we're dealing with chronic pain or chronic fatigue or arthritis and chronic pain, there is a hyper focus on what you can't do. And that really doesn't serve you, because you keep stewing in the I can't do this, I can't do that. Well, you're missing out on all the other opportunities of the things you can do. And so that's why we had given you that list earlier on in the slides of different exercise options. So you go to the one that resonates with you the most, that you can do most of those movements, and you stick with it and you practice it. But at the end of each session, celebrate like what you did was an accomplishment. And I think that's really important, that you focus that your body, give your body a pat on the back and thank it for what it's just done for you for that day.
Just one thing or two things to add. I don't use the word exercise with all of my patients anymore. The minute that unfortunately had a negative vibe, people think exercise, I'm going to be a marathon runner, or I'm going to lift bench press a couple of 100 pounds. So there's a long stigma toward it. And this is only maybe true for maybe less than 1% of the population, if way less than that. All we're looking for is just movement. Just move,
Yeah.
and it has to be a little bit structured. The other point that I felt guilty or felt a trap of myself and made that mistake in the past, I always compared with myself with the best part of me. So if, as everybody knows, if you don't know, I had a car accident myself, and left me kind of crippled with that chronic pain, back pain, knee pain for over 11 years. And I always compared myself, what could I do now, even after I was able to control my pain, to compare to before I got my car accident. And this is a false comparison, because I can't compare myself when I'm in my 40s compared to what I was doing in my 20s. Well, even if I didn't have a car accident, I might have a decline in function. So what I
Right.
started to do to make it more clear, I'm going to compare it with colleagues of mine that did not have chronic pain or a car accident, and I want to see what their level of activity and what's mine. And we were almost comparable right now. So you can't compare yourself with the best peak of your life and say, I can't do that. I can't run a half a marathon. I can't do whatever. Compare yourself with colleagues who around that age group or around that same circle that you had, and you'll see you can achieve that, and you're not that far off. And
Hmm.
always the other part is, especially with yoga, I was guilty of it too. I was always looking at people
Yeah.
doing all those funky moves, and I say, well,
Yes.
I can hardly sit on the chair, I can't hardly sit on the floor, right? And till one of the instructors kind of looked at me, and she kind of noticed that I'm scouting around and said, always compare yourself to yourself. What you could do now compared to what you did 2 or 3 weeks ago. You are
Correct.
your baseline. It's between you and you. It had nothing to do with the others. Nobody cares if you can put your leg over your neck, right?
Yep.
The question is, can those movement, whatever we call it, whether it's walking, biking, yoga, could it improve your quality of life? The answer is yes. Would it reduce your pain? 100% it will do. But you have to be a little bit wise about it. That's when we go through those plans that we talked about. You don't push yourself for too much, then you back off, and now you lost faith, or your body lost faith in those activities.
Yeah.
You have to build that trust between you and your body, because you haven't been doing that for a while, and you have to go easy at it, but build upon it.
Absolutely. It's funny you mentioned about that yoga piece because actually the last time, so I've practiced yoga from the age of like 19 to maybe like 33, and I've done through many different styles of yoga. And there was a session, so doing pigeon pose, which
Yeah.
essentially you have your one leg forward and another leg um, to the back of you. And it's interesting how exercise can engage that mental health piece because I was struggling in that moment with perfectionism. I wanted to get the pose perfect. And I ended up moving my leg in a way that caused my kneecap to shift one way as my leg went the opposite way. And let me tell you, that was incredibly painful. And I could not walk. Actually, I was going to France like a week later. Um, but long story short, I did not go back to yoga for almost an entire year after that incident because it shocked me to the core, like the way how that affected my joint. Um, but a lot of that was me trying to push myself to be quote unquote perfect. So I missed the biggest lesson of yoga, which is essentially like be in your body. You don't have to compare yourself to others and you don't have to be perfect, but you have to listen to your body.
Yep. But that's a little bit tricky. I totally relate to you, Crystal. But some people use that as an excuse that, hey, my body, I'm listening to my body, so I can't do it. That's
Yeah.
not what we're trying to mean with that one. As
Yes.
you need to push yourself a little bit, but not too
Yeah.
much. That's where that wisdom and dialogue happens between what I plan to do, what my body is capable. That's when you need that baseline. If you don't do a baseline for anything, you're gonna injure yourself much more, and it's gonna give you more negative impact than anything positive. So
Yeah.
even if you want to start with yoga, see what your baseline, just like what we did with walking. Your baseline is 1,000 steps. That's cool. Let's see what your range of motion with yoga without pushing yourself, right?
Yeah.
Let's see your baseline with your breathing. How long can you take your breath in and hold it? How long can you breathe out and hold it? And when you journal all of those, that's where you start from. After 2 or 3 months, if I keep improving upon those, can I improve or uh, improve upon that baseline? And that's what you're trying to achieve, right?
Absolutely. So this is a product that we recommend at Arthritis VIP when we're working with any of our arthritis patients. I I love this product so goddamn much. I tell my patients it's kind of like nature's Advil or Tylenol. So it's an anti-inflammatory. It helps to support healthy metabolism and cellular function. It is amazing for period cramps and just for overall arthritic pains. It is important though, because this is a very potent version of turmeric, that you do take this with food. If you take this on an empty stomach, it's highly likely that you will experience some type of digestive upset, typically heartburn, people will report. So you do want to take this with food. And it's such a great foundational thing to have in your arsenal as you're helping to increase movement on your daily, um, to really ensure that we're quelling any inflammation that might make it harder for you to want to get up and move the following day.
I love it. I used it myself. There's two things I would like to mention here. Just what Crystal said, always take it with food. I try to take it without, and it really hurts your stomach. Second thing, I want to remind any people who's getting for a procedure when we do the PRP, the platelet rich plasma, do not take it a week before, a week after. We want the
Yes.
inflammation. That's not the time to settle it down. And one last personal bit of experience is if you are on any of the oral probiotics that we suggest, don't take them together. I'd like separate a couple of hours in between. I'd like the probiotic to feed the first thing in the morning, and maybe the curcuma bale around 11, 12 o'clock. I don't know if you have a different uh, idea about how you use the combo of those, Crystal?
I don't really have a preference for separating. I mean, definitely with probiotics, they always need to be taken before 2 p.m. So ideally first thing in the morning. With curcuma bale, though, I mean, my only thing that I stress with my patients is that it has to be taken with food. That's kind of a non-negotiable with that one.
Yep. But probiotic, we want them on an empty stomach, right?
So the probiotics that we recommend, typically they survive the gastric acid, so they do go down to the large intestine. So I'm not really too fussed about whether or not they take it with or without food, because a lot of the probiotics now are coated. The capsules are coated appropriately. So yeah, I don't really have a preference for with or without food when it comes to probiotics.
Awesome. That's good to know. Because I got
Yeah.
a couple of questions from people coming in. Should we mix and match and whatever? Yeah. So
Yeah. So that explains why you were saying to separate them. But for the most part, with what we're recommending probiotic wise, you can take it with or without food.
perfect. Oh, one more thing about that. Don't mix it up with any Advil, naproxen. That
Yes.
that's way too much. So if you're taking NSAIDs of any sorts, over the counter or prescribed, you do not mix it with that curcumin bale.
Beautiful. That's a good point.
Yeah. So back to this slide that we always try to wrap up our talks with it. So with the physical stressors right here, we talked about injuries, then overuse. That's majority of the people. That's not the issue. It's usually the underuse, the sedentary lifestyle, or the poor posture. So a combination of those. What we're trying to achieve is by the physical activity, the movement, is to get rid. So yoga is going to help with the posture, walking, and any sort of minor cardio, less impactful cardio is going to help with the lifestyle to help move of the circulation.
Absolutely.
Yeah. So, and as we talked before, it's going to help you if you gonna have that as a routine in terms of the movement, not necessarily call it as an exercise, is going to help your diet. It's going to help you reduce the amount of smoking, if not quit smoking. You're gonna be craving better food, better quality food. It's gonna help you sleep when you move to the emotional part. If you go with walks with your partner, it's gonna help engage you two together. It means that
Yes.
this is less social media, less bad news, less isolation.
Yes.
So literally, it's one of the pillar, and that's what we focus on when you come to the clinic. Is we want to get you fit to start walking. That's why all about the prolotherapy, the PRP therapy, the shockwave therapy. We want to get you moving, but at the
Yes.
same time, we want you to work on the chemical and emotional stressor. But if we can't get you moving, the rest of it becomes more obsolete, right?
Yes. Absolutely. And I also do love that piece that you mentioned earlier on about how movement, any type of movement improves your overall digestion in general. Because, as a naturopathic doctor, I often like hold the belief system that a lot of dysfunction starts in the gut. And, I can recommend tons of things to help improve your gut health. But if you're not doing the movement, you're really limiting yourself at that point.
Well, it's funny that you say that from uh, a medical doctor, going full circle myself, what we got taught and what I've noticed personally as a byproduct of a being chronic pain patient, everything starts with the gut. Every
Yeah.
arthritis, all what you need to do is you're kind of borderline when we eat junky food, we don't sleep well, we stress out all the time. You're just waiting. It's more of a ticking bomb to have a little bit of an injury that you could have healed when you're 5 or 10 years old. Now, because everything is compromised, that's
Yeah.
what you're going to trigger that chronic pain or arthritis. And one of the things that always one of the analogies or the examples that I tell people, the everything starts with a ligament injury, whether we like it or not. When the body feels unstable, it's going to go into spasm, causing all the tendons to inflame. That's when you get tendonitis, you get muscle spasm. Then
Hmm.
eventually the nerves will be trapped under those fascial planes. That's when you get nerve pain. But the funny part, if you look at it, when people eat junky food, eat processed food, smoking, alcohol, lack of mobility, now you're
Not
gonna
drinking enough water too.
exactly. So now
Yeah.
your gut system is not working well. So toxins and subclinical viral and bacterial infection will seep into the bloodstream. The body wants to fight that, but those bacteria and toxin want to hide somewhere. Where do they hide? In
Hmm.
places that has the least blood supply, ligaments, tendons, and joints,
Right.
right? And if you don't move and you get all that blood flow coming to that area, literally they just this is their heaven. They love in
Yes.
those areas because there's no blood supply. So again, to relap, go full circle, when we do the probiotic and we do all the IV infusion therapy, what we try to do is improve the immune system or improve the absorption in the gut flora to act as a first line of defense while we're treating on the other end, we're treating the joint, ligament, and tendon with all the modalities that we have. So we can tackle it from both ends. And
Yeah.
that's the rationale why we treat the gut with all the probiotics, with the glutathione, with the infusion therapy, because we want the gut lining to be very protective to you, start the immune system, absorb better food, and yet so you don't produce more toxins or like let more toxin go in while treat the other side.
Right. Tell ya, I hope everyone's listening to today's episode because I think you dropped some really important gems towards the end of today's presentation to help kind of bring things full circle to maybe how they develop their arthritic condition and how they can help themselves today.
Yeah, it's unfortunately most of the system is fragmented when it comes to Western medicine. And it
Yeah.
just looks at one aspect. So it's all of is it called anti-inflammatory, muscle relaxant, pain killers, nerve block. I'm not treating any underlying cause, whether it's the gut or the
Right.
subsequent of it, the joint or whatever. And even with what we learned, which is funny and ironic, when you get injured, they call it RICE, rest, ice, compress,
Yes.
and elevate. That's one of the worst things that you do. You want inflammation.
Yes.
You don't want to ice it. You want
Yes.
to move. You don't
Yep.
want to rest. That's what triggers all other joint injuries, right? Yeah, you
100%.
want
It's
to.
funny because I'm doing it in Chinese medicine because I practice a lot of Chinese medicine. That's exactly it. Like whenever we hear like rice therapy, we're like, Jesus Christ, that is the worst thing you can do to a patient.
I
Because in
know.
Chinese medicine theory, it's all about flow. It's about creating the inflammation, creating heat, creating circulation to
Yes.
heal the joint. Yeah.
Yeah. So does ice have a room? Sure, maybe for the first couple of hours just to reduce that swelling, but not after that. Day two and
Yeah.
moving on, you need to start putting more heat on it, more walking. And yeah, the more you baby it, the more you're going to be destined to arthritis, chronic pain, tendonitis, ligament injury, and the list goes on.
Yeah. Absolutely. Well,
Awesome.
thank you. You've
Thank,
educated me.
Well,
as
thank you very
always.
much. At least like we can see eye and eye, even though we've been working with each other for over 2 years, but now we see that, hey, listen, we have more common than we think.
Absolutely.
Yeah. Awesome. Guys, if anybody has question and you're not here online, you can always reach out to our chat platform. You can send a text message to the group, and we will answer that either by email or by a phone call. And thank you very much for attending, and thank you, Dr. Crystal, for being with us today.
Yep. Thank you.
Awesome. Good night, everybody.
All right. Good night. See you.
Bye.
Okay. Bye.